Hello guys, welcome to my YouTube channel. Our today's topic is uvea disease. So the uvea is highly vascular layer that lines the sclera, and its principal function is to provide nutrition to the eye. So uvea हमारी eyes की highly vascular layer है that lines the sclera. तो जो हमारी uvea है वो उसमें बहुत सारी ब्लड वेसल्स होती हैं जो कि हमारे अनदर पार्ट्स ऑफ द आई को न्यूट्रिशन देते हैं एंड इट्स principal function is to provide nutrition to the eye. The aqueous is responsible for the metabolism of an anterior segment by diffusion of metabolites through the aqueous. सो जो हमारा एक्वस ह्यूमर है, जो लिक्विड हमारी आइज़ के एंटीरियर सेगमेंट में होता है, वो रिस्पॉन्सिबल होता है मेटाबॉलिज्म ऑफ एंटीरियर सेगमेंट by diffusion of metabolites through the aqueous. So now uveitis is immunogenic in origin with arthritis. For example, the ciliary body secretes aqueous which bathes the avascular structure of the anterior segment. So as you know, the ciliary body secretes aqueous humor which bathes the avascular structure यानी कॉर्निया. The ciliary body provides nutrition to the cornea. Its vascularity unfortunately allows the frequent involvement of the uveal tract in systemic vascular, immune and infectious diseases. Uvea is made up of iris, ciliary body and choroid. So as you know, iris is the color part of the eye and ciliary body holds the lens, and choroid is the middle layer of the eye, and it is a highly vascular layer. Now we will talk about uveitis. Uveitis is the inflammation of uvea. The term uveitis emphasizes the close relationship between anatomically distinct parts of the uveal tract. Basically, it is the inflammation of iris, ciliary body, and choroid. Iritis never occurs without some cyclitis, nor cyclitis without some iritis. Standardization of uveitis nomenclature, classification based on anatomical location. Iridocyclitis, iritis plus pars pellicatus. Pars pellicata is the part of ciliary body. Pars pellica is the part of ciliary body. Okay, pars planitis, posterior part of the ciliary body, is called pars planitis. Now choroid plus retina is called chorioretinitis, and panuveitis is the inflammation of whole uvea. So classification based on pathology. Granulomatous iridocyclitis. It is characterized by the presence of large greasy mutton fat keratic precipitate which are deposit of WBCs or lymphocytes. So it is characterized by presence of large greasy mutton fat. So जब हमें granulomatous iridocyclitis हो जाता है तो हमें हमारे एंटीरियर चैम्बर में मटन फैट के पीस मिलते हैं जो कि हमारे WBCs के डिपॉजिट होते हैं. यानी जब भी हमारी बॉडी में कोई इन्फेक्शन होता है तो हमारी जो WBCs हैं वो सबसे पहले उस इन्फेक्शन या बैक्टीरिया से लड़ने के लिए उस इन्फेक्शन के प्लेस पर पहुंचते हैं. तो इसलिए हमें मटन फैट के पीस मिलते हैं इन केस ऑफ granulomatous iridocyclitis, derived from the aqueous on the corneal endothelium and dense posterior synaptia with cluster of inflammatory cells either on pupillary border or on the peripheral part of the anterior surface of the iris. And if it will be non-pigmented, then it will be called lymphocytes, and mutton fat kps are macrophages. So as you know, macrophages are wbcs which can directly eat the bacteria. Their principal function is this: granulomatous uveitis may be due to invasion of the eye by living organism or autoimmune etiology. Now we'll talk about granulomatous uveitis. It is characterized by the presence of fine capes. There is a considerable flare and cells in AC sometimes form hypopion. So hypopion, as you know, that pus in anterior chamber. Capes are composed of lymphoid cells and polymorphs. These are the type of WBCs. Now we will talk about etiopathogenesis of uveitis, infective exogenous infection due to the introduction into the eye of organism through a perforating wound or ulcer. This result usually in acute iridocyclitis of a suppurative type endophthalmitis and sometimes in a panophthalmitis. So now we will talk about secondary infection caused due to spread from one or another of ocular tissues, cornea, sclera or retina. Endogenous infection, organism primarily lost some organ of the body reach the eye through the bloodstream. This comprises infections such as tuberculosis, syphilis, gonorrhea, viral infections such as smallpox, influenza, the protozoal infections such as toxoplasmosis, immune related inflammation. The infection is generalized due to escape of organisms into the bloodstream when ocular tissue become sensitized to them. So this is all about uvea and uveitis. Thanks for watching my video.